Hi, welcome back to my channel. If you're new here, my name is Dr. LaTrice Montgomery, and the purpose of this channel is to discuss marijuana from a scientific perspective, as well as the host of other psychology-related research and activities. So in today's video, we're going to discuss the documentary that was released a few days ago on November 18th on BET, and the name of it was Smoke, Marijuana in Black America. And it was executive produced by Nas, and it featured many different celebrities and politicians, lawmakers, advocates, etc. And it discussed the status of marijuana or cannabis in the Black community. So what I wanted to do is actually take some time to review some of the issues that were raised within the particular documentary. But rather than kind of hearing me ramble on and on like how I do, y'all know how I do, I thought I would bring on a very special guest who would also be willing to talk with me about some of the issues as I took notes on some of the things that were raised. So I'm going to ask her a few questions and just get her thoughts. So as we talk, feel free to jot down things and leave questions down in the comments if you have any. I've also included a link to some of Dr. Ayana Jordan, who is my special guest. I'm going to talk with her in a few minutes. I'm going to leave a link down below. You can receive more information about her. She is an amazing, amazing researcher, amazing clinician, is doing a lot of great work, and most importantly, is my friend. She's a dear friend of mine and colleague, and so I'm excited to have her on the channel today. So make sure you check out her information below. So without further ado, I am going to kick things off and move right over to the interview with Dr. Ayana Jordan, who is an assistant professor, addiction psychiatrist, and MD/Ph.D. Put some respect on her name, Dr. Ayana Jordan. Okay, so welcome to my YouTube channel. Welcome back, everybody. I am so excited today because we have my first guest on the channel, Dr. Ayana Jordan. She is a dear friend and colleague of mine, and I'm so excited to have her on today. As promised, I mentioned that I was going to review the documentary Smoke, Marijuana in Black America. It touches on a lot of the issues that I researched, so I wanted to make sure that I talked about it and discuss some of the key points that they raised. But I know you always hear me every week chatting and rambling on about different topics, so I wanted to bring somebody else who I deeply admire and I think has a great perspective on these issues. I wanted to invite her today and just ask her a few questions and just let us have a discussion about some of the issues that were raised. So thank you so much.
Of course, I am so happy to be here, Dr. Montgomery. I love you. I tell everybody about you. So thanks for having me as your guest for sure.
Oh, thank you. And thank you. And yes, so this is Dr. Ayana Jordan. She is an assistant professor at the Yale University School of Medicine, Al. And so I'm so proud of her, super excited, and just, I'm more excited to call her my friend. So thank you so much for joining. So I'm going to jump right in. I have a few questions for you. So I pulled them up on my phone because I was taking notes because the documentary came on November 18th. It was a 2-hour special featured on BET, executive produced by Nas. And basically, there were many stories that were followed. And really the idea that they presented in the documentary is that the Black community has been disproportionately impacted by the enforcement of marijuana laws and policies within our country. And so even though Black people and white people use marijuana at similar rates, Black people are more likely to be arrested, more likely to suffer health consequences related to their use, etc. So there's all these issues that are related to marijuana, particularly in the Black community. But on the other hand, now we see that there are people who are making millions, if not billions of dollars off of the same thing that is placing Black people in prison. And so, really the issue was that there are all of these different disparities. And so first of all, raising awareness about it, because I think a lot of people weren't necessarily aware of some of the things that they talked about in the documentary. But one of the issues that I wanted to talk to you about today is just specifically kind of getting your thoughts around marijuana use in the Black community. So when you think about the disparities and you see the legal industry, both for recreational and medical purposes, what are your general thoughts around these issues?
Yeah, I mean, again, and I'm so happy that you're using this platform to raise awareness, especially for our folks, Black people, because we often are left out of the conversation. So having a channel directly focused on this is super important. everything that is happening is by design. So I always say we have to be very clear in terms of even the way in which we discuss cannabis. And I really have at a time in my career where I try and use cannabis because of the historical roots of the word marijuana, understanding that the word itself is not racist, but it was used as a way to vilify people who use cannabis, and really thinking about, you know, uh, targeting like Mexicans who were using this drug to make them crazy, and marijuana, all of this. So I try and just be very devoid of even using marijuana and just use cannabis. So when I'm talking about marijuana, I'm using cannabis, and I'm being very deliberate in that because I am trying to not unintentionally perpetuate something that was meant to be racist and to alienate or make it seem like, folks who were using this type of substance were somehow devilish. And that was the type of language that was used. And I start out, and I'm going to come around. I know I'm being a little circumstantial, but I'll get to the point.
Oh, yeah.
Yeah, I come back because the point is now that there is a movement to really legalize or try to medicalize cannabis, it has nothing to do with the research, because really the research to date has shown us that we're not sure what's safe, what's not safe. And so even to think about the use of medical cannabis is a misnomer itself, because there's many different ways that people use it, but we really don't have the data at this point to support that it truly is medical. But that's very different than the social justice issue. What you're asking is the business of it, right? Mm-hmm. And so yet again, we're seeing through structural racism, which are policies in place, right, that allow structures to continue the inequities that advantage white people and disadvantage Black folks and other people of color. We're seeing that in the cannabis industry. It's much more difficult for Black folks to be able to secure loans, to be able to invest. And then if you think about what you've talked about already, Dr. Montgomery, at the beginning of this, is that we're more likely to suffer carceral involvement as a result of our cannabis use, whether it's use or through possession. So if you think about who can now start a business, it's harder if you have a history of involvement in the carceral system. And we're more likely, because of the racist war on drugs, that again was started by Harry Anslinger, who was the director of the Federal Bureau for Narcotics. So this all goes back to policies that were in place that made it difficult for us to be able to not be involved in the legal system. And because of these policies, we were vilified, more likely to be involved in the legal system. Now we have the business of cannabis, where predominantly white folks are able to secure the loans, are able to market in a way that we are systematically left out. So to me, it's not an issue of what is happening. That is exactly how it's designed to be. And so all of my advocacy is really reversing the historical and present consequences of the racist war on drugs, and using cannabis and the industry of cannabis to be able to allow resources in terms of really money. I always say, get your coins, to make it easier for people to become entrepreneurs. Mm-hmm. That's very different. We should have that same opportunity, but that's very different than what do we know about the science and the data to be able to treat. I think it's really misleading to the general public to make it seem like, we have some special medical knowledge to make it okay to use cannabis. Cannabis is cannabis is cannabis. What we need to do is be able to decriminalize it, legalize it, which is two different things, mm-hmm. to be able to make it much easier to study. Dr. Montgomery, I know you understand this, because it is scheduled in a way that it makes it even difficult for researchers to get access to it, so that we can really be able to have an informed risk stratification. these are the folks that we really don't think should use it based on this data. This is okay. And then be able to provide guidance on safe use, right? Not recreational versus medical cannabis. That is just a false distinction. It really is. And so I think having these conversations and us being involved in the discussion will help us be able to think more critically about these issues. Yeah, I mean, I think one of the my kind of role models in this space in terms of a Black woman who is really taking advantage of this legalization and trying to make it more accessible for more Black folks to be able to have a business model is Mary Pryor. And I was able to learn about her work just in terms of I May Destroy You, some work we did with HBO. And the use of cannabis was throughout the entire production. And so really thinking about beyond use, whether you use cannabis or not, whether you think it's okay, Black people should still have the same access to be able to start the business. And we don't, right? And a lot of that is really based on the process of our involvement in the carceral system, but also things like redlining, just lots of historical principles that has made it very, very difficult for us to get a piece of the pie. And so that's what we need to focus on, and making it easier for us to break into the business. It's a big business, multi-billion dollar business. So we need to have more involvement. So I love that, Nasir, shout out to Nas, I love him, has been able to curate this to spark discussion. Sure.
Absolutely. And I appreciate your perspective and definitely talking about, I mean, you touched on so many good things and talking about even the use of marijuana versus cannabis. I mean, that's something that I'm constantly thinking about and constantly trying to be conscious of in my work. But it's so interesting because you talked about there not being a lot of science in the space, and that's even just a struggle there. So like for me as a researcher in this space, I talk a lot about cannabis, but then also when I'm out like in the community talking about, like, let's say, hey, the Ohio Medical Marijuana Control Program, it's like, those are the words that are being used. So I find myself kind of going back and forth between the two terms, but it is so important. You raised such a good issue. So thank you for bringing that up. And, a lot of the issues, I think, especially related to Black people and marijuana, there's so many different layers. And so one of the things that I struggle with, and I'd be curious to kind of hear your perspective, you touched on this a bit, but there is the research part of it where there isn't a lot of science. So we know that marijuana, medical marijuana or medical cannabis is being given to people for different conditions. It's always happening, whether or not, we like it or it's happening all over the place. And so, but on the other hand, as you mentioned, there's a social justice piece where, here in Ohio, for example, there are not a lot of dispensary owners that are Black. There's a very small number, and that's actually very similar across the country. And so, but at the same time, if you look at, the folks who have been arrested, or you look, in prison for the people who are sitting in jail for possession or sell, it's like those numbers are extremely high. And so from that perspective and that angle, I'm a huge advocate of ensuring that, because basically one of the things they even said in the documentary is that the cannabis industry was built on the backs of Black people. And that was the point that was explicitly mentioned, but then also kind of woven throughout a lot of the stories that were told in the documentary. And so for me, the struggle sometimes is that on one hand, I want to push out, social justice piece and make sure that, you said, we get a piece of the pie. But on the other hand, I also want to ensure there's also kind of like the health part of me, kind of this is a public health expert, just thinking about what are the impacts of saying that, we have this product or these products that are available, but we don't have the science to support it. And so there's always struggle, between the two different worlds that I find myself in often. And that's actually why I got into this space of marijuana, because I started doing research on recreational marijuana, as you know, and particularly in the Black community. And I would always get the question of, well, how can you tell me to stop smoking weed and stop doing all these different things. But then there's states that are legalizing it and people are using it for their pain or their, glaucoma or whatever else. It's like, how can you give those two different messages? And so a question that I have for you is, what do you tell, particularly Black patients that you might have, like that have questions about it? What do you say to that dilemma?
Yeah, no, I love that. And I think, I'm going to call you Dr. Montgomery to put some respect on your name, but I know we're Ayana and LaTrice. For the sake of this, I'm going to call you Dr. Montgomery because you've earned it. But I think this feeling, this ambivalence is not new to us as Black women in this space, right? We have coexisted in a predominantly white space and been successful in a overwhelmingly white supremacist construct. And when I mean that, I don't mean it in a bad way, just really idealizing the ways in which white ideals and norms are really set as the standard. And we kind of got to prove ourselves and work twice and thrice as hard to be able to achieve success. So I just want to just speak truth to power to how uncomfortable it is to have to straddle these worlds, and yet it's a feeling that is not new to us. Mm-hmm. So that's an ongoing feeling that I have outside of cannabis or anything else. But I think the point is this, and this is an ongoing philosophy that I have embraced as an addiction psychiatrist who takes care of predominantly Black and brown folks, and really thinking about how can I optimize their wellness? And so I allow them to, at the end of the day, have their own autonomy. You get to make the choice, but it's my job as a physician to give you the data and give you the facts. So I'm like, whether or not society is making a distinction between recreational or cannabis, that is a foolish, false dichotomy. The same thing that's happening, we were just discussing a little bit earlier in terms of telling people not to be with their families for Thanksgiving, but then allowing the restaurants to stay open. At the end of the day, Black people have to understand you are your best advocate. You have to be able to make the decision to take care of yourself. Unfortunately, we would love to have a society in which you could not have conflicting messages, but that's not where we are. And so it's my job as a physician, it's my job as a researcher to give you the information and the knowledge you need to make an informed decision. So this is what I do know, that there are very few medical reasons that have been shown via research trials that cannabis has vastly improved the outcome. Some of those things are the treatment of glaucoma, being able to stimulate appetite when people who are undergoing cancer treatment, being able to ease pain for terminal illnesses. These are things that we have data for. Not a lot, but some. Things that we do not have good data for are things that many people go for medical cannabis. And I'm saying this because I know that, again, I do not believe in this differentiation between recreational and medical indication. Things are depression, anxiety. What are some other things? Insomnia. All of these things we don't have good research for, but at the same time, people are dispensing cannabis. Doesn't mean that they can't help you, but we don't have the population data. So what I do know is if you have a history of psychosis in your family, meaning somebody is not in touch with reality, these are things like being constantly paranoid, thinking that you can hear things that other people can't hear, seeing things that other people can't see. Also having destabilization in terms of your ups and downs, or what we might call a bipolar disorder. These things can predispose you to having odd reactions to cannabis. And so I say to people, it's best if you wait until you are finishing in terms of your developing brain, right? So if we can get you through to 25 and you're not actively using cannabis, great, because that really is like, knock yourself out, 26. If you made it that time, knock yourself out, smoke some weed, see how it goes. But I don't want you to set yourself up for failure between the age of adolescence up to 25, right? Especially with that history. Also, we have to be very honest that if the use of the substance, whether you have a family history of psychosis or some type of other mental illness or not, if the use of cannabis is not allowing you to function, what do I mean by that? You're high all day, that you can't work, you can't take care of your children, you can't interact with others. Regardless if it's medical or recreational, we need to be able to talk about the use of this substance, just like anything, is preventing you from reaching your goals. So I want to work with you to figure out how can we reduce the use so that you'll be able to function, right? So that's the way in which I talk to folks, especially my patients, especially Black patients, about it. Also, I have to be very clear. Even in society, like for instance, New Jersey just legalized recreational cannabis. But if you're in New York, what you gonna do if you go across the bridge and you got a dime bag? Like the bottom line is that the neighborhoods that you're more likely to hang in are over policed. So this is when the structural piece comes on. It doesn't matter what's on the books. Your Black behind's going to get pulled over with the dime bag. And if you say, well, I was in Jersey, they're not going to care. So then you are predisposing yourself to harm because there isn't a national way to really think about legislating. So I 100% think that there should be decriminalization, legalization of cannabis across our nation. But as we've seen with the pandemic, we can't always entrust what's best for our communities in terms of what politicians need to do, because sometimes it lags, and that's what we're seeing. So the key point is it causing dysfunction in your life? If it is, how can we minimize that use? If you have a way to not use consistently until you get past the age of 25, when neuronal development is complete, that would be ideal. If you are not down with any of that, then can we think about ways of minimizing the THC percentage? Because let me tell you, Dr. Montgomery, when I was a teenager, compared to the percentage of THC, which is the active ingredient, right, that gets you high, and cannabis nowadays is way higher, right? Anywhere from 28% all the way, if we get to wax, in the 60s and 80s% of THC. So how can we move from loud or wax, or somebody told me Al Green, I'm learning all these terms, to reg weed, which has much lower levels of THC. Also, I think we just have to realize that folks are just want to make money too. So thinking about the difference between CBD and THC, and they got all types of products like CBD in your coffee, CBD oil in your lotions. I mean, this is all foolishness. Yes, it may help this person or that person, but also that's not rooted in science. So my job is to give you access to information. You make an informed decision. I'm going to tell you your risk based on the data that I have. If you are someone that has already had a bad reaction, meaning that you could become acutely paranoid, psychotic, I am not going to recommend that you use cannabis recreationally or medically, realizing it's foolishness, this distinction. And so, yes, there are people that genuinely have developed cannabis use disorders. Do I think that the propensity of that is blown out of proportion? Absolutely, right? But at the same time, we can't think that just because something is legal, that it's safe. And I use the best example, and I'll stop talking. Are you finished or are you done? I'm almost done, Dr. Montgomery.
You good. Go ahead, Dr. Jordan, and tell the people.
Yes, in terms of alcohol. So alcohol is legal, kills way more people than opiate use disorder, right?
Mhm.
Still, if you get caught driving under the influence of alcohol, you can very well be involved in the carceral system as opposed to getting help, right? So again, just because making cannabis legal, I think that's a necessary step, but that's not going to stop from people being involved in the carceral or legal system as a result of its status, legalization status. And also, it doesn't mean that it does not have harm for certain folks. So our job is really to figure out, as scientists, who has the most harm, but also as public health advocates, how can we provide information so people can make the best decision for them?
Mm-hmm. And you touched on so many great points. That's why I'm just saying here, like, yes, because I mean, so many good things that you said. And really, the big piece of all of this is education. And that's something that I've been really big on and been thinking about, particularly as it relates to just research in this space, because, you know, as you know, there's not a great body of research, particularly on the medical use of cannabis. But then you start digging even deeper and thinking about some of the issues we're talking about around disparities. I mean, you're lucky if you can find a couple of articles in the space. Right. So that's one of the things that I'm really big on, particularly as it relates to education, because one of the things that I'm also finding is that as I'm kind of doing my informal research and really kind of getting more connected in the medical cannabis industry and meeting people and like talking to attorneys and advocates and people from all over the space, is that actually, very interestingly, there's a lot of politics that are involved in this, as is with almost everything. Yeah. But politics specifically related to the use of research as a marketing tool. And so there's also this piece of it that, you know, I want to be, you know, inform people about, and particularly within our community, because there is this ideal that if a particular medical marijuana or cannabis company is linked with an academic institution or with an academic researcher, that somehow implies an endorsement. Right. And so people begin to think, oh, well, they have this, study with Yale or this study with UC or this study. And so it's like, that automatically means that it must be okay. And so one of the things that I'm hoping to do is to be able to help kind of break down some of the barriers to help us to understand, okay, if there is research that's out there, which research should we be pushing, or which research should we be saying this is exactly what we're looking for? And like the randomized clinical trial, as we know, is what we need in this space, but there isn't a lot of that here. And so, so I'm hoping that, by kind of doing things like this and, just being able to kind of talk about some of these issues, because I don't think there's enough of these type of discussions happening. And when they are happening, they definitely don't always include our voices. And so that's why I'm just excited to have you on today, because I really just wanted to push out some of these issues and really get it out there, because we're often left out of these discussions. And I think this is important, of why it's not only important to involve the Black community, Black people in this space, but also Black researchers, and that we can all come together and really kind of amplify our voices and our experiences and make sure that, these disparities, that as the industry grows, that these disparities don't continue to grow with it.
No, and I think honestly, Dr. Montgomery, one of the things that I look to you for always is really thinking about being a pioneer in terms of health disparities research, specifically in the case of Black men who use tobacco and cannabis. Like, that's it. You are the expert. I send folks to you, but every single paper, Dr. Montgomery, and I'm like, okay, we got to put some respect on her name, because one of the things that you're talking about in terms of education is really having the knowledge to say, the studies that do exist, are they even adequately powered to understand how this affects Black folks? The answer is no. All right. And then really looking to who is actually doing the research to see how it particularly affects our folks and how we use it. Because we know that most of our folks are not smoking cannabis via bongs and pipes, and we're rolling right? So that's important because we don't know what are the long-term ramifications, if there are any, or the effects in terms of like your research, the co-use, right? So really needing you to inform the space, but then also being a cultural broker to be able to say, okay, but this is what this means in layman's terms. So really from your work, I've been able to say, okay, let's minimize the tobacco and cannabis use. And if you're going to use one or the other, use them separately, and then thinking about really harm reduction, right? And so I think it's so important, like you said, who is involved in this work and allowing people to know, yes, if a white male is advocating that cannabis should be used freely, that is from the perspective of how it's affecting a largely white, male-dominated experience, which is going to be very different for you. For instance, we're not in a culture where if a Black woman or a Black man has to do urine toxicology for a job and it's still legal. I'm saying legal because it can be legal on the books, but how is that operationalized in society? Because your Black behind can go and try and get that job, and it could be just as legal as it is in Washington, D.C., but you won't get the job, right? Because we have to understand through the context of social justice, the ways in which society sees us will be more likely to be looked at as a drug addict, right? Or more of a negative light, whereas white folks will be seen as someone who is just recreationally using. And so these are the discussions that we need to have, these open, honest conversations. And Dr. Montgomery, you have really brought this to the forefront for us to be able to really understand all things are not created equal. And even if there are policies now that allow for the use, the ways in which those policies affect us is different, and we need to educate ourselves around it. And as researchers who are Black and have a deep love for Black people, how might we think about creative ways to minimize the disparity? Because we know it's nothing about Black people per se that causes us to have these worse outcomes. It's racism, right? So the system of race, which is a totally man-made construct that has no biological determinism, meaning that there's nothing genetic within us that makes Black people have more problems or more involvement in the legal system. It is the racist systems that preferentially advantage white folks that leave us at the end of the barrel. So we have to understand that even if we have maybe 5-10 years from now, because I do think the wave is going to be for there to be legalization of cannabis throughout the state. So even if we have the data 10-15 years from now to say, okay, it's totally safe, great. We don't have that data, but even if we got that, I still want people to understand the lens in which you would use it and how that affects your interpersonal interactions, your ability to, own dispensaries is going to be vastly affected by the color of your skin because of racism. And so as researchers, we need to figure out, how do we mitigate that? What are ways that we can be very clear in creating anti-racist frameworks to look at this? Are there ways that we might employ methodology to expose how different folks with a positive THC or a positive toxicology for cannabis are treated, right? Really going through to see what are the systematic barriers that prevent Black people and other people of color from being part of the corporate profit of cannabis. These are the things, and only our perspective is going to be represented because of the experiences that which we have, right? So I think it's just so important, and I'm really, really happy that you're using your platform not only to educate, but to really think about all of these cultural considerations. So it's beyond like, do you smoke or not? Like, no, does this mean that you're going to lose your job?
Right, right. Yeah, thank you so much for, first of all, thank you for all your kind words. I appreciate it, and
I always say, put some respect on Dr. Montgomery's name. I bring you up in every single case because there's nobody out here with their breadth in terms of how much they publish, but also the depth of looking at it through a cultural lens and then figuring out how to endorse a harm reduction approach so that people can be safe in their use.
Yeah, so thank you for that. But I must say, we got to put some respect on your name because I need my viewers to know who you are because we got all the respect for your name. So I'm actually going to include a link down below in the bio to describe, some of the work that you've done. But if you could please just take just a few minutes because you have some great, amazing stuff happening right now in the community, especially in the Black church. And so if you could just take a few minutes and tell the folks what you got going on, and I think it's just it's a perfect example of really a lot of the things that we've been talking about around the importance of making sure our voices are represented, making sure that we're, represented in this space. And so, yes, take it away because we definitely put some respect on your name.
Thank you, Dr. Montgomery. And I love that because you were with me, started from the bottom, now we're here.
Yes, definitely.
Trying to get feedback on grants.
Yes.
So I'm really excited because a couple of things. I really think about really taking care of patients, education of the future addiction specialists who come from Black and other communities of color, and then research. So in the clinical space, what I was seeing, which is similar to what a lot of us experience, is that there wasn't equitable treatment of folks who look like me who had addiction. So lots of stigma, people having all types of judgment, if they were even going to do well in treatment before they even got through the doors, just based on their chart. And so really thinking about, is there ways in which we can create systems of care outside of the traditional addiction clinic or mental health system that allows people to be seen in their true self as part of the community that may have had some difficulties, but they're still affirming and they are still worthy of their humanity. So one of the ways that I thought it was important to do that, and this really modeling after Obenga Ogabegdi's work, who's an internist who has done a lot of work with faith-based and other community institutions, showing that they were able to control hypertension and prevent end organ damage by bringing treatment outside of the hospital. And so in that same way, we've been able to partner with churches throughout the state of Connecticut and show that not only can we provide addiction treatment in the church, but people show up and they stay involved in care. So really eliminating this narrative that has been published about us that we don't want care, that we drop out from care. Like, yeah, we drop out from care that's not culturally affirming and doesn't see us as people, right?
Right.
Worthy of treatment. So I am just really excited to explore this, and I'm so happy to have support by the National Institutes of Alcohol Use and Alcoholism through independent funding, what we call R01, to be able to study treatment in the Black church setting versus treatment as usual in the addiction clinic and see who does better. I have my money on us doing better in the Black church, but this is why we have to do the research to really see what happens. The other thing that I'm really, really proud of, Dr. Montgomery, and I'm so grateful for this platform, is to think about how do we prepare the next generation of addiction specialists and really taking care of our people in a way that sees them in their comprehensive self, not just physical self, but mind, body, spirit, soul, all of it. And we're able to create what's called the REACH program that's funded by the Substance Use and Mental Health Services Administration in collaboration with the Academy of Addiction Psychiatry. And this program is awesome because we work with racial and ethnic minorities who are interested in pursuing a career in addiction, but want to focus on Black and other folks of color. So what are the ways, what do I need to teach them about the racist war on drugs and how the policies that exist, for instance, the no-knock warrant policy that resulted in Breonna Taylor being killed? What they need to know and how they can really engage in advocacy to reverse some of those racist policies. The different types of racism and how that shows up in treatment. So we are really providing a blueprint for taking care of our people in a way that has never been established before. So if you want more information about that, go to reachgrant.org, because that's an awesome way that we're shifting who is involved in this space, right? And then finally, Dr. Montgomery, we have to talk about your role in the LEAD program, which is how we met and really thinking about minority researchers who are specifically interested in conducting addiction research in communities of color. And so you have been so successful in that space that they said, come on and join us as a faculty. And so this is how you slowly change the culture by having these programs, but then also lifting as we climb, going back and saying, let me have this platform and let me bring in Dr. Jordan. Let me bring in some other amazing young folks who are doing this work and can have that cultural brokering. Like, who else is watching smoke?
Right.
You know, to be able to bring it to the people. Right. This is what we're talking about, having that liaison to the culture, that we get it. We know that folks are not even calling it, maybe they're calling it marijuana, but really they're calling that ooh-wee or weed or whatever, to be able to say, this is what we know, and don't get caught up in the foolishness of medical versus recreational, but this is the education that we want to provide so that you can make the best decision.
Yes. Yes. So as you see, that's why I say put some respect on her name, because you are doing such amazing work. And I want to rewind back to the part 2. I just want to, just a little flex on your RL1. So just tell folks exactly like what percentage of Black folks is getting RL1s. Like, I think you break it on down for us.
It's really terrible. But in 2020, the 21st century, less than 2% of all federally funded independent research awards are given to Black scientists. And that's really a tragedy, because these are our tax dollars. And so then we have to reckon with, why is that the case? And if only less than 2% are actually getting funded to do independent research, what topics are being funded, right? Exactly. And why is there persistent disparity in funding of Black researchers? We have to look at the racism within the review process. So there's so many levels that we have to break down, and yet here we are, and yet we continue to persist. So that's why I always say, oh yeah, I'm got to be a part of this process, because I'm going to be the one that says, you better fund such and such as grant, because this is the work that we need to do in order to take better care of our community. It's racism, not race, that causes these disparities, and how can we better take care of our folks and provide the education they need to take care of themselves?
Yes, I'm here for all of it. So thank you so much. I mean, you always, I enjoy talking to you all the time, because I just always learn so much from you. I love your passion and just the work that you're doing. You're doing amazing work in the community. Like you said, we started from the bottom. I remember us hustling. We was at UCSF writing our grants and getting feedback, and it's like, read this, does this make sense? And here we are. So congratulations on all the great work you're doing. And like you said, this is for the culture, this is for the community. And so I'm just excited to be able to know, there's, like you said, there's not many of us, but we're definitely here, and we are, a tight-knit community, and definitely have a lot of great work that we're doing. So thank you so much for joining us today. And I'm definitely going to include all your information down in the description so folks can reach out to you and read more about you. And thank you so much. And I don't know if you have any last words or anything you want to say before we close out.
No, I just say Black girl magic. I'm so thankful. I'm so proud of you. And let's just keep pushing. We gotta save our folks for sure.
Yes.
Yeah.
Yes, absolutely. All righty.
Okay. Take care. Bye-bye.
Take care.